Yes, I said yes, Uncle Kenny.
Uncle
I'm
Kenny.
here.
Okay. All right. It's the accent. This is why I'm going to ask you to say your name because in a million years I couldn't possibly pronounce it. You can say your name now,
Well,
nephew.
it's not that difficult if you are Albanian.
I've left
So
Albania a
the
long
name
time
is,
ago.
I know. The name is Brian de Miraci.
Okay. Okay. And you're very famous in Albania. I know that. Very famous.
You are flattering me, but yes, I think I'm well known.
Okay. Now, you're an oral and maxillofacial surgeon, correct?
Yes, exactly.
Okay. And but you trained in Germany,
Yes, I did the specialization there.
three different universities. They kept kicking you out of one. You had to go to another one.
No. It was another thing. The problem is, at the time, I was working with the military, and the program was financed by the German military. And this program was, so to say, involved with three different universities. So
Wow.
that's why I had to travel all along German. I've seen perhaps much more than many Germans I've seen.
Okay. So you were also, when you graduated, you became chief of the oral and maxillofacial surgery department in the Albanian University, right?
Exactly. I've
Exactly.
been doing that for like 10 years.
For how long? 10 years.
Yes.
Okay. And the things that really caught my attention were, other than the fact that you're heavily involved in a variety of places, you do a lot of endodontics. What is this endodontics business with you?
If I wouldn't have been oromaxillofacial surgeon, I would have been an endodontist. My
Really?
first mentor was at school was my professor of endodontics. So this is how it started. But then later things got a little mixed up, and then I ended up doing what I do now. But
Okay.
I still have a good hand in endodontics, you know.
You still do it?
I can still do a root canal. I'm good at it.
Show me an X-ray.
I can do it too. I'm going to sit then later to you. Don't worry. How many canals? One more?
Five. Has to be five. Lower molar with five canals.
Okay, I'll try to find one. But
Okay. Okay.
if I can't find mine, I will get my wife's. So she is the endodontist in the family, and
Okay.
she can perhaps indulge in every kind of situation of this type.
All
But
right.
I treat, more the surgery stuff in endodontics. That's what
Okay.
I was also speaking last year in Cagliari,
You spoke
if
on
you remember.
endodontic surgery. I remember you spoke on endodontic surgery, correct?
Yes.
But you're doing, you also do like corticotomies. You were talking about the scope of what you do. Endo, ortho, the implants. Ortho is the corticotomies, right? You were doing a presentation on it,
Yes, yes, yes,
correct? Yeah.
yes, yes. I have so with a partner of mine, we have a protocol in accelerated orthodontics through corticotomy and then bone grafting.
But you also have sticky tooth. What's sticky tooth?
Yes.
I heard sticky bone. I have never heard of sticky tooth.
Well, if you have heard sticky bone,
Yeah.
you have to know the tooth can also become a sticky product. Yeah. If you get the tooth, you can grind it and you can make it become sticky. I use the Cometa Bio product, if I can say it. I don't know if I can mention products
Absolutely.
and
Be as
so on.
commercial as you want. That's okay.
So we use the grinder of Cometa Bio to, grind the tooth. And then afterwards, I had the first protocol to, make it sticky because it comes out from the machine wet and then it has to, be dried up and then you can then add fibrin, uncoagulated fibrin, which is then later going to set up, and then you can make it sticky too.
Okay. But
It's a
you
very
also,
stable material.
I'm
It's
sorry,
very
what?
good, you know.
It is.
It's very good.
It is. For dinner, like do you barbecue it as well?
It's like sushi, you know.
Okay. You also were involved with what is PAOO? I don't, it's a technique for hard and soft tissue grafting.
So the one of the techniques of corticotomy is this parodontally accelerated orthodontics. So
Okay.
that's the acronym for that.
All right. So that's your bona fides. That's your good stuff. Like you're famous, you're well known, you're talented, you're an inventor, you're all over the place, you're at University of California, et cetera, et cetera. So that's you, that's who you are, and we all love you dearly.
That's who I am.
Okay. Now, but more importantly, you are on the Global Implantology Institute. What is that? Can you tell me about that?
Uh, global, the Global Summits Institute
Right.
is a gathering of doctors from dentistry, medicine, pharmacy, philosophy, optometry, and chiropractic, which are gathered together, to improve medicine and make it come to the doctors. As you very well know, medicine is now run up by politicians, by the big pharma, and by many others which are not doctors. We are trying to bring it back to the ones that it should belong to. Medicine was practiced for like 2 millennia from doctors. Hippocrates was, so to say, the first to try to put the name on the profession, but for many years, doctors could do their business without the need of these third parties. And now we are left in their, so to say, in their hand. I want to be delicate here. I don't want to, be a little pushy. And we are just doing job for them. I
Okay.
believe you would agree that this is so. But it's not going very well for what I see the world going today for doctors and for also for the population, because if it's not guided by the ones that are involved the direction that really affects human with having done the Hippocratic oath and so on, the rest of them are just treating it like business. It's not a good thing. Or at least this is what gathered us together and what we think it should be right. So we are trying to bring medicine back to the ones that it should be. So to the doctors and the other professions that practice it. They are the ones that should lead, so to say.
So how are you able to do this? Are you involved with government making policies and that sort of thing? Do you have people that act in?
We are definitely also involved with several governmental policy makers, politicians, and so on. We are trying to push in this direction. So we want medicine to be much more human.
Okay.
And to be able to do so, we have to get rid of these third parties that are, pushing us in their commercial direction. They are involved and they are doing business. We don't think that medicine should be a business.
So how did you connect with pharmacists and chiropractors? How did this come about? This is not strictly dentists and doctors.
No, it's all of them has got their representation in the Global Summits Institute. They have their representation there, and we also have the HEX committee, which is made of all of these professions.
The HEX committee is what?
HEX committee is a high commission of doctors of medicine, dentistry, chiropractic, philosophy, optometry. All of them are gathered together in order to improve medicine. And as you have seen there, many of them were not dentists.
Yeah. So how did those people come together? How did that happen?
Well, these ideals, it's not that only dentists share. Kianar Shah had the idea, and then all of them gathered together to this main idea with this purpose. So everybody wanted to have an independent medicine from the third parties, and everybody is trying to do their job in their professions, so to say, to help in this direction.
Interesting. So how does this come up to the gala? How does all this lead into the gala at the Congress in 2023 in June in Sardinia?
Well, as you know, the Global Summit Institute has their top 100 doctors, which are now at their fourth edition, and there are like 700-800 of them till now, because it's just dentistry. It's dentistry, medicine, and all the rest of the professions. So the top doctors, the 100 top doctors of this year, they are going to, get the prize. Their award is going to be given to the gala that is going to be held in Sardinia in June, 8th to 10th June.
So how many people are coming? How many people are being asked to come? What is the total of all this? How many people are involved?
It's going to be like 1,000 and more doctors that are going to be there. And
Seriously.
like half of them are going to be key opinion leaders.
Okay.
Many other parties are involved, as you perhaps know a little bit. So many organizations are going to send representation there, and they are going to, be together, and we're going to organize a big discussion in one of the days to, so to say, decide the future of medicine in the point of view of the doctors.
Okay. So how does this relate to the dental part? Because it's the focus on simplicity and excellence. How does that, I think that's the name. How does this correlate? Like you've got two simultaneous programs going on at the same time. I guess that simultaneous at the same time.
The idea to do, yes. The idea to do that came to us last year. I was speaker in this event, and also a couple of other doctors that are organizing this year. So Kianar Shah, Pretinder Singh, and Enrico Lai and Giancarlo Couch, they were all together, and we decided why not do this year. We liked the venue; it was fantastic. I'm going to give a presentation later on. You see, it's a very nice resort. It's a 5 stars resort in one of the best places in the world, if you can say. So why not? Why not do this there?
Okay. Are you going to wear that shirt with the lemons on it when you present?
When I was presenting last year, I was a little more complicated. I'm going to show you how I was presenting last
Okay,
year.
fair enough.
This year it's going to be with tuxedos and so on. I wanted the shirt for this because it's with lemons and it has to, it's involved with Italy, with South Italy actually.
Okay, fair enough.
I bought it in Capri like a couple of months ago, and that's why I wanted to take it for a year.
The fellow that is your endodontic mentor is from, I mean, I don't mean to go off track too often, but he's an endodontist, this fellow in Rome, your current mentor in endodontics?
So to say, I don't have mentors in endodontics. I have a friend that is practicing in Rome. If you want, I can mention him.
Sure. He's an endodontist. Keep mentioning him. That's okay.
He is an endodontist in Rome, and he gives me, so to say, exchange opinions about stuff. He was the mentor for my wife because he is the endodontist, so to say, in the family. And that's why we became friends. And I have treated also a couple of cysts for him, referral from him.
Okay.
They came all the way from Italy too.
Really?
Yeah.
So outside of working with...
many people can treat hot Joe kyst.
Yeah. Okay.
And then feel later on this one will be stable.
Fair enough. So we've switched gears.
Many of them. Okay, I'm one of them.
You are. So I want to go back to the gala for a second, the event on Sardinia, and gets going on at the same time as the dental one. You have a presentation to show, correct? Can we bring that up?
This year's presentation, I believe, is going to be about corticotomy. So about my approach in treating orthodontic cases and making them easy.
That too.
Orthodontic has to also evolve.
I want to see the presentation on the gala. I want to know what I'm eating.
I believe it's going to be good stuff.
Okay.
Last year was good. This year is going to be better. You tasted last year, didn't you?
No, I don't remember. We were in a restaurant.
Well, it's 6 months ago. Of course, you don't remember. It's not that you remember everywhere you've been.
It's gone. So you have a PowerPoint presentation, right? Let's take a look at what this is about. Okay.
Yeah, I'm going to you want me to share the screen now?
Share the screen, please.
You have it now.
Yeah,
okay.
Got it.
So this is the map of the Mediterranean area, which many consider to be the cradle of humanity because of the big names that came out of the area, because it's here with Africa, with Europe in the middle. And since we are here, this is Sardinia,
Hmm.
and this here is my homeland. It's
Uh-huh.
Albania. So as you can see, we are in the same direction. Sardinia is the second largest island in the Mediterranean area. And since we are there, here is where the gala will be held. So in the south of Sardinia. As you remember, we're speakers there. So this is with a friend Pretinder Singh, which I want to salute. And this is what I was wearing last year that you didn't
Ah,
see.
much better. Okay, much better.
We are wanting to gather leading doctors of medicine, pharmacy, dentistry, philosophy, optometry, and chiropractic all together in this island in Italy during the days of the Congress. Since we liked the venue so much, we decided to do this here. So it's going to be the first annual Doctors World Gala with around 1,000 doctors, which half of them are key opinion leaders in their profession. Enrico is going to organize the Congress and is also co-organizing with us the gala.
Okay.
It's going to be in the same venue. This is
Okay.
how Enrico is involved. So it's going to be scientific, and it's also going to be all the rest of this, so to say, stuff that is going to happen that I'm going to explain now later
Okay.
on. So the first annual Doctors World Gala will be held in partnership with the Italian Dental Association during the 12th International Congress of there in the island Sardinia, 8th to 10 June next year. And there, the top 100 doctors of this year, many of them are famous. I'm going to give you just one of the famous guys, perhaps Professor Giovanni Zucchelli rings a bell. I believe
Sure.
many know him. And many others which are famous in their profession are going to get their award there. It's going to include red carpet reception, an expo, award ceremony, dinner, live entertainment, networking opportunities, and of course, cultural events. Since the word was come out, many of the other guys of the previous generation of top doctors since 2020 wanted to gather up. So in the social media, many of them were, liking to be there and wanted to be there. And that's why we came out in the idea to do this red carpet hall style event.
Wait, stop.
Why?
Do I get a Ferrari?
Definitely, we're gonna have big names in the industry.
Okay.
If it's not gonna be Ferrari, it's gonna be Lamborghini or something, Maserati,
I
something
get a
like that.
Lamborghini? Wait, that's one of the things? I get a Lamborghini?
Yeah, everybody's going to go Lamborghini now. If you want to buy it, you can buy it there, but it's gonna be a couple of them staying there.
Okay.
Like if we are doing the Oscars,
Okay.
I didn't like only the actors to have it. Why should only actors and regis and so on? I believe we work harder, don't we? The red carpet event is going to be like this, and you have to wear well, and you have to have your invitation. I know you are invited, so your invitation is a must. Otherwise, bodyguards won't let you in,
Okay.
We're going to, of course, definitely have some bodyguards there. It's not that we are going to allow everybody to get in. Anyway, it's going to be also the cap and gown ceremony where these 100 doctors are going to, receive their award. This is me last year when I had a similar event, which we want to reply because I liked a lot. The shoes, you mean? It's Calvin Klein.
The shoes.
I can say the name. The shoes, what do you mean, man? What do you like?
Beautiful. I like the shoes. Italian.
Okay. Thanks. We're in Italy. What can we do?
There you go.
We have to respect the host. So, in the big hall, it's going to be the regents and the Hex Commission of the Global Summits Institute. We're going to be leading a debate about the future of medicine. Okay. As I told you before, we want to make it more medicine directed. not so politician and profits directed, but possibly as much as possible in the direction of doctors. So we know what's best for our patients. That's what we should do. Many of the stuff that is going to be done now, it's not, so to say, doctors and patients directed. It's not good. I believe the situation, many people are complaining about it. Doctors, of course, but even the population is not so happy about what's happening right now. So we want to know what these doctors think about the situation, and of course how they want to improve it. And if we have like 1,000 of them there, I believe it's going to be a very good conversation, and many people is going to learn something about it.
This is separate from the dental one, right? You have the dental one is going on in one room. You're going to have this.
So the dental one is going on, and then all these other activities are going to happen in the afternoons and in the evenings.
Okay.
So all the day is going to be involved with something. Either it's going to be scientific, if you want to go to the Congress, which I'm going to explain later on, because you don't leave me, Uncle. Please, Uncle, let me finish.
Okay,
young generation, we don't know stuff.
Okay.
Okay. So networking on a large scale. Have you got another opportunity to get like 500 key opinion leaders altogether? I don't think so. Okay. So you can meet them, and the venue is not so enormous as in this big congresses where you can, difficultly find people. You can find them there, and you are going to, discuss about stuff in your business, so on, with them. These are some of the guys that I met last year. This year is going to be like 10 times more. So I believe it's going to be important. Oh, look, it's Uncle Kenny there. It's also one of the big guys.
There you go. I like your shirt again. I like the shirt. You wear nice shirts. Your shirts are very cool.
So much nice food is going to be involved, since you were talking about food. This was the nice Italian beer that I tested for the first time this last year there. I'm going to, try it again, and much more stuff. And of course, the winners are going to be involved with many of these guys all coming together and having fun. So it's going to be really a very nice event. And of course, it's going to be a big concert. This was last year's. About this year, so we are having planned to have like several, people to do that, but I don't want to spoil it. It's like 6 months before. I don't want to say too much. But let's go to the important stuff. Also, the 12th International Congress of the Italian Dental Association is going to be in the same venue this year. For the moment, there are like 75 speakers, as you can see, big names in dentistry and also in medicine. Lots of maxillofacial surgeons you can see in there. But it's going to be even more. So it's like even like a couple of like 10 more planned to speak, which are not in this representation, but it's going to be soon there. Okay. So it's going to be a very big event, even intellectually. So it's much to learn there from these people in all the branches of dentistry.
So let me stop you for 1 second. So you've got Raquel Zita, you had Devora Arad Schwartz, you've got Angelo, Walker Devoto, Uli, I forget his last name, Uli.
Stile Italiano has got a whole session there.
Yeah.
So it's going to be orthodontics, it's going to be hands-on surgeries are planned, robotics, dentistry is also planned, zygomatic and pterygoid implants are also going to have an hands-on there. It's going to be a couple of famous guys, which are not yet in the presentation, but it's going to be soon. Okay. So many things to do. The Congress is really going to be big and full this year. So much bigger than last year because of the, there is many people to choose. The top doctors are going to be there. Many of them wanted to present, so many of them have, we have even more that want to speak, and we can't, because of the fact that there is too much people, we can't allow them to.
You didn't ask me to speak.
My friend, you can speak whatever you want in many branches of dentistry, but it's not only a decision of mine to make. You know, it's a committee that decides this, and I don't put me in this position, Uncle, because I don't want to be, you know, blamed for stuff that I'm doing here.
Okay, fair enough.
Okay. So, the Congress is going to offer up to 30 credit hours, several hands-on, and more. So it's all accredited, and it's a good occasion to get it for not much money. It's not going to cost much. I'm not going to say now numbers, but you can check and you can see that it's not going to be like this so very big pricey events than you see online, and then at the end you don't do nothing. But this year you are going to do the rest that you didn't finish last year. You know, there are many things you can organize, because many are, you know, going to skip for the part of the lectures and are going to do the touristic stuff. So much of this stuff you can perhaps see this year.
Okay.
So it always seems impossible until it's done. And I'm going to leave you with this small, so to say, video with like protagonists. One is Albanian. Definitely, it was John Belushi, which is impressionated by me in this one. My team did a very good job. You will see now. It's going to be very funny, and I'm going to, you know, finish with this.
Okay.
And then we can finish together at the end.
I'm a soul man. I'm a soul man. I'm a soul man. I'm a soul man. Got what I got the hard way. And I'll make it better every day. So honey, don't you fret, 'cause you ain't seen nothing yet. I'm a soul man. I'm a soul man. Play it, Steve. I'm a soul man. I'm a soul man.
Well, that looks awesome. Like, Enrico and Giancarlo are taking care of it. They're on the ground, right?
Yes, yes, definitely. So they are on the ground. We are helping at the backstage. We have, you know, meetings almost once a week or once in 2 weeks. So it's something that's important. So we want it to be perfect. We are trying to do the best to you know, make it work as best as we can.
I'm going to say goodbye. You have a good day, actually a good evening, and we'll talk to you soon. Okay?